Aminoglycosides, navigating ototoxic and nephrotoxic risks. Aminoglycoside antibiotics present significant challenges in clinical management due to their potential for serious adverse effects. These medications can cause profound damage to two critical physiological systems, the inner ear and the kidneys. Clinicians must carefully monitor patients receiving aminoglycosides, with particular attention to hearing function and renal performance. Ototoxicity manifests as damage to the inner ear structures, potentially resulting in permanent hearing loss or vestibular dysfunction. Nephrotoxicity occurs through direct cellular damage to kidney tubules, which can lead to acute renal failure. The risk increases with prolonged exposure, higher dosages, and pre-existing renal impairment. Metformin, the silent vitamin B12 deficiency trigger. Metformin, a cornerstone in diabetes management, carries a notable risk of vitamin B12 malabsorption. Long-term use can progressively deplete vitamin B12 levels, potentially leading to significant neurological and hematological complications. Healthcare providers should consider periodic vitamin B12 screening for patients on prolonged metformin therapy. The mechanism involves metformin's interference with vitamin B12 absorption in the small intestine. Patients may develop subtle symptoms of deficiency, including peripheral neuropathy, cognitive changes, and macrocytic anemia. Routine monitoring and potential supplementation can mitigate these risks. Opioids, managing persistent constipation. Opioid medications consistently produce constipation as a predictable physiological response. The drug's interaction with mu-opioid receptors in the gastrointestinal tract leads to decreased intestinal motility and increased fluid absorption. This effect occurs across all opioid classes and dosages. Proactive management strategies are crucial. Clinicians should implement prophylactic interventions, including stool softeners, increased hydration, dietary modifications, and potentially prescribing specific opioid-induced constipation medications. Patient education regarding early symptom recognition remains paramount. Vancomycin, understanding red man syndrome. Vancomycin infusion can trigger a distinctive adverse reaction known as red man syndrome. This inflammatory response typically manifests as rapid onset of flushing, erythema, and pruritus, predominantly affecting the face, neck, and upper torso. The reaction is most common during rapid intravenous administration. Prevention strategies include slower infusion rates and potential premedication with antihistamines. While typically benign, severe cases can progress to hypotension and anaphylactoid reactions. Careful monitoring during vancomycin administration is essential for patient safety. Isoniazid, pyridoxine deficiency management. Isoniazid, a critical tuberculosis treatment, disrupts pyridoxine, vitamin B6 metabolism. This interference can lead to significant neurological complications if left unaddressed. Clinicians routinely recommend prophylactic pyridoxine supplementation to counteract potential deficiency. Neurological symptoms of pyridoxine deficiency include peripheral neuropathy, characterized by numbness, tingling, and potential motor dysfunction. Supplementation typically involves 50 milligrams to 100 milligrams of pyridoxine daily during isoniazid treatment. Phenytoin, recognizing gingival enlargement. Phenytoin, an important antiepileptic medication, can induce notable gingival hyperplasia. This condition involves progressive soft tissue overgrowth of the gums, potentially leading to significant oral health complications. The prevalence ranges between 20% to 30% of long-term users. Comprehensive oral hygiene becomes critical for patients on phenytoin. Regular dental evaluations, meticulous brushing techniques, and potential periodontal interventions can help manage this adverse effect. Genetic predisposition and concurrent medication interactions may influence individual risk.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.